Victoria Emerton, and today I'm delighted to be joined by Jaime Bishop, who's Chair of Architects for Health and founder of Fleet Architects. Jaime, thanks for joining me today and welcome to this podcast.
Thanks for having me.
So Architects for Health will be exhibiting at Healthcare Estates on stand H1, and you also have a networking area in the exhibition, which is sponsored by SDS. You've also put together the content for the Design in Construction exhibition theatre, so a lot going on, and thank you so much for your involvement in the event this year. So please tell us a little bit about yourself and what your interest is in Healthcare Estates.
From a personal perspective, I've been working in healthcare design for over 25 years. And I think I was trying to work out when I first attended Healthcare Estates. It was probably at least 20 years ago, I guess. So, and for that time, it's remained one of the top events in our industry and carries forward sort of the professionalism, integrity, and curiousness of IHEM as an organisation, and a lot of the values that we have as Architects for Health as well. As Architects for Health, Healthcare Estates has been a cornerstone to our own calendar of events. It's one of our biggest events in our year of events. Since I joined AfH in the mid 2000s, and in recent years, we've expanded our involvement beyond our stand, which kind of traditionally showcases our members' work, to, as you mentioned, the networking area sponsored by SDS. And the Design and Construction Theatre, which I think is proven to be very popular and have really consistently high caliber content through the years. So.
Yeah, we love working with you. You're always very involved in the event, and we really appreciate the contribution that Architects for Health make to Healthcare Estates. So what have you got planned for the Design and Construction Theatre in 2025? Okay,
so a 2-day programme, pretty packed. I probably should caveat this that there may be some changing in order, but what we're currently looking at is the approach to the curation of the Design and Construction Theatre is sort of through the lens of mind, mend, and matter, which is how we curate our own calendar through the year. We're exploring how spaces support mental well-being, healing and recovery, and long-term resilience across healthcare estates. Day one focuses a lot more on mental health and workforce well-being, kicking off with trauma-informed design and how architecture can actually be part of the healing process, which sets the tone. We then look at workforce retention through the design of welcoming, supportive environments, drawing on real NHS projects that are already showing impact. There's also a strong thread around integration, not just between departments, but also across physical and mental health needs. For instance, one session looks at how hospitals can better support young people with complex conditions through more flexible, universal spaces. What's exciting is that we're not just looking and talking about new buildings. The realism of today is that we need to be looking at how we work with our existing estate and make better use or more effective use of what we have. So, for instance, we're looking at a project for my own office at Berrywood Hospital in Northamptonshire, where a number of strategic and quite modest interventions have made a really big difference to a design of a ward for young people. We're also looking at diagnostics and community care, how shifting services out of big hospitals into towns can improve outcomes and reduce pressure. That ties in with the broader need to tackle the NHS backlog creatively with strategic investment and targeted upgrades rather than just big capital spends. When we move into day two, we're leaning more towards strategic and digital future of estates. We're hearing from people involved in long-term master planning, using data and digital tools to guide smarter investment decisions. There's a real emphasis on flexibility, sustainability, and the power of good planning to future-proof our healthcare estates. We round things off with co-design and person-centered care, not just engaging people, but really embedding arts and culture into the process. So we design places that truly reflect the needs of those who use them. We hope that it's quite a balanced program. They're always quite informal and engaging. We find the audiences really do like to get involved. But it's also grounded in real projects. As always, we're keen to show that good design isn't just about aesthetics. Good design is about how you respond to how people inhabit and use the space, and how design can have a tangible impact on recovery, care, and making the best use of not just every square metre of space we have, but also every pound that's spent.
All crucial things to cover, and it sounds like there's a, as you say, a well balanced program there, and a lot for people to take home. I think you've got something for everybody, and the beauty of the Design and Construction Theatre is it's on the exhibition floor. It's available for anybody coming to the event to attend, whether you're a delegate, a visitor, or an exhibitor, or a speaker in any one of the forums at the show. So I expect it'll be really busy. It's a kind of case of get there early to get a seat, I think. Otherwise, tends to be standing room only, doesn't it?
It does, yeah.
So you sound like a veteran of the event. I've been working on the event for about 12 years now, but you exceed me if you've been coming for 20 years. So what are you looking forward to at Healthcare Estates this year?
I mean, there's a lot to look forward to, and I could give you an extremely long answer, but I think probably the first thing that comes to mind is actually just meeting up with colleagues and friends across the industry. We all work kind of in the silos of our projects, and actually it's moments like this that actually give us the opportunity to sort of chat a bit more informally. There's a lot of sort of breakout conversations that take place, and I think part of that the design and construction theatre kind of embodies that ethos as well, because you sort of get people walking past and getting drawn in because they hear something that's interesting. So I think there's I think it's that side of things. Obviously it's great when you attend a talk and you find out something new that you didn't know. It's also really useful to walk around the exhibition and find out about new products, because again, when you're deep in projects, you don't really get that opportunity to explore and understand what's out there. So quite a broad range of things I'm looking forward to, but often it's those informal interactions and things you don't necessarily expect.
So that's it for this episode. Thank you so much for your time today, Jamie. A reminder that Healthcare Estates takes place on the 21st and 22nd of October at Manchester Central. Registration is currently open. The programme will be coming shortly, but we look forward to seeing you, Jamie, and all your colleagues from Architects for Health at the event. Thank you again for being such an important part and bringing all the right people to the event through your stand and the Design and Construction Theatre. Thank you very much for your time today, and we'll see you in October.
Thanks, it's been a pleasure.